If you look at the therapeutics, which I'm taking right now.
President Trump received an experimental antibody cocktail as part of his treatment at Walter Reed Hospital for COVID-19. The antibody treatment, developed by Regeneron Pharmaceuticals, attempts to substitute or supplement a patient's immune system with antibodies to fight the virus. It has recently been shown in a study to reduce the amount of virus in mildly sick patients and reduce the duration of symptoms. Now, the Mayo Clinic is conducting a clinical trial on the use of the treatment on moderately or severely ill patients.
I think there's great reason to be optimistic that this will have therapeutic potential.
Dr. Andrew Badley is the Mayo Clinic's chairman of the COVID Research Task Force. He says antibody treatments have already had very positive results in test tube and animal experiments.
Good morning, everyone.
President Trump's physician, Dr. Sean Conley, revealed the president was also given dexamethasone, a very strong steroid that's been used for many years for other conditions that is now being used to treat patients with COVID-19.
Many centers, including Mayo, use dexamethasone or other steroids for patients who have respiratory insufficiency and COVID disease.
Dr. Badley says he doesn't know about the president's illness to comment on his treatment specifically, but he said that dexamethasone is generally only used on patients with moderate to severe COVID-19 symptoms.
So there's no evidence that it is useful earlier in the disease. And in some studies, there was a trend, not statistically significant, but a trend towards worse outcomes if you used it earlier in disease.
Lou Raguse, KARE 11 News.